afternoon, everyone. Welcome back to a long anticipated season four. I know we took kind of a few weeks break, but we're hitting it hard back with a really, really good episode. Matt, I'm excited about this one. We've been talking about it for a while. So let's get it started.
Yeah, I'm glad to be back. Let's do it. What's up, Doc?
What's up, guys? Matt,
Yeah,
Chris, how's it going?
very well. You want to introduce yourself real quick and just kind of give our listeners an idea of what we're going to be talking about today, and then we'll get started. I'm excited.
Awesome. Well, this is definitely an organic conversation. I'll preface, I know none of the questions. That's beautiful, right? This is just organic. You'll feel the flow. So my name is Dr. James Latham. I'm a board certified anesthesiologist. I have two partners, Dr. Wong, Dr. Sharma, and together we co-founded Advanced Wellness and Pain. We have two ketamine clinics, one in Scottsdale, one in Gilbert. This is our COVID pivot. We left the hospital-based anesthesia practice. We saw there was a need for mental health because there's a lot of people suffering, nowadays. Mental illness is very prevalent, and we felt the treatments that were currently out there were not adequate enough, and we felt we could kind of bring a new dynamic to the industry. And so in 2020, we started doing the ketamine infusions, and slowly but surely, we changed from doing anesthesia to this. And this is my passion, man. It's such an honor and privilege to be able to help people to navigate mental health challenges, chronic pain syndromes. We do a lot of work with first responders for PTSD, and now we're full-time between our two clinics. We do a lot of exciting stuff. Ketamine infusions is the main thing. We just recently added on doing stellate ganglion blocks for PTSD, hypervigilance. We do a dual sympathetic reset, so I'm feeling like more like an anesthesiologist again versus just giving the infusions. But this is the only federally legal psychedelic medicine is ketamine right now, and psychedelic just means mind revealing. So I'm trying to get you to reveal your subconscious mind to your conscious mind. But I've been in graduated med school 2011. Finished residency 2015. So, really 10 years out in private
Yeah.
practice. And
Well, Doc,
yeah, man, it's
I have
awesome.
I have a question for you. So,
Yeah.
Obviously we've spoke off camera and you kind of know my role. Like I'm kind of asked the everyday question, right?
I love it. Yeah.
So, when I hear the word ketamine, right?
Yeah.
That sounds dangerous. Okay? What obviously it's not if it's controlled and in a controlled environment, right? But okay, take me through the pros of ketamine infusion use and maybe some what could be some cons, like what could be some side effects or something like that. I'm curious because I'd like to know more.
Yeah, totally. I mean, sure, everything in life can be a tool or a weapon.
Yep.
Whether it's like money, love, ketamine, psychedelics, everything's a tool or weapon. So it's all about the intention behind why we're engaging with this substance. So ketamine, some of the pros is that you don't have to feel worse before you get to feel better. It's the most rapid acting antidepressant we have in all of medicine. They've been hailing it the biggest breakthrough in depression treatment in over 50 years. It works on a very unique receptor system called the NMDA receptor, and it's an antagonist or blocks that receptor system. And then by doing that at subanesthetic doses, you're increasing something called glutamate. Glutamate is your brain's most abundant excitatory neurotransmitter. And so when we do that, we get this rapid increase in neuroplasticity mediated through brain-derived neurotrophic factor. Now, there's a lot of big words, but the science behind it really matters, right? Because normally if you're struggling with depression, anxiety, PTSD, you're going to do talk therapy. You're going to most likely be offered SSRIs, other mood stabilizers, and sometimes you can feel worse before you even feel better. And it's just masking symptoms. I'm trying to get you to actually heal, right? Because I want you to reveal your subconscious to your conscious. Because ultimately, my point of view is it's me versus me. It's just you versus you of yesterday. And I want you to reveal that to yourself by accessing a non-ordinary state in a very controlled environment. And so, sure, Matthew Perry, obviously, that's ketamine gone wrong. We're not giving people injectable ketamine at home alone, and then who knows what could happen, right? That's the worst case scenario. This is in a very controlled environment, in a program. We have a workbook for integration. We have integration coaches. You're prepared. You do the integration sessions the day after your infusions. This is a structured program around the medicine. Now, the thing with ketamine is it's like the Wild West right now. Every single clinic is a little bit different.
I was gonna
And a lot of
ask
them
you,
are like
yeah.
treat them and street them. And so I'm trying to give you comprehensive care around the medicine. No one has a ketamine deficiency, right? So this is like a tool in knowing that what you have a deficiency of is revealing yourself to yourself, right? Getting in touch with your true self, your authentic self. The ketamine's a catalyst, for doing that. But most common side effects: nausea, headache, fatigue, constipation. I can fix 95% of those with medications in the clinic. So we've done close to 10,000 infusions right now. So we do have this really dialed in. We understand it in 5 years
Can it
of
be, you brought up Matthew Perry, right? And can it be addictive? Can it become addictive? Like, I mean, I know you guys do it at Advanced Wellness. It's controlled environment. There's programs. I get it. But can someone become addicted to it to where now they're like, hey, I'm done with my treatments. Doc was great. But that feeling, that psychedelic or whatever that sensation is, now I need to go find it on the street, or kind of like the Matthew Perry route, like what kind of talk about that a little bit.
Totally. Well, anything that makes you feel good, whether it's a substance or behavior, can have the potential for addiction. So we got to look at addiction from like a physiologic standpoint and then a psychologic standpoint. And so really you got to define addiction as you're continuing to engage in a substance or behavior. Here's the key part: despite negative consequences. If there's no negative consequences, it's not really an addiction. It could be a habit or a behavior. And so sure, ketamine, if you do it enough every single day, you could get some physiologic addiction, but it's more so a psychologic addiction, because the way it works on the receptors, it's just blocking the NMDA receptor for the most part. So think of it like we're just closing the door. We're not feeding the receptor. Whereas opioids, benzodiazepines, you're feeding the receptor. Then the receptor gets hungry and you're going to feel the withdrawal essentially. So I'll use ketamine actually to get people off of some of these more addictive substances, opioids, kratom, Suboxone, alcohol, things like that. So we can use it as a bridge, because the physiologic addiction is not that bad. Of course, anything can be abused and misused. So it's all about the intention behind it. But in our clinic, when you do a series of 6 infusions, generally 2 to 3 a week for 2 to 3 weeks, we do not see any addiction with that. If anything, psychedelics, like, it's a mental marathon in there. It's almost anti-addictive. Like, I don't know if I want to go in there and like,
I don't want to go down that road again.
It's a lot. Like, it's not. So like, is it escapism, or are you looking to connect with yourself? You got to ask yourself that question.
Dorothy didn't want to go down that path sometimes. That
the rabbit hole.
Once was enough.
So I was gonna, when I hear the word psychedelic, right, I think of like drugs like
LSD and mushrooms,
or what is the new one?
DMT.
The spirit molecule,
the one, not ashwagandha, but the
ayahuasca,
ibogaine,
right?
Ibogaine,
So like drugs like that, where does ketamine kind of fall in the hierarchy of psychedelics?
That's a fantastic question, man. I love talking about this kind of stuff. So first, let's talk about the origin of the word psychedelic, right? So psyche, mind or spirit. Delic comes from the Greek word delos, to reveal meaning or to manifest. And the word actually was first coined in a conversation between Humphrey Osmond and Aldous Huxley in a letter back in 1956. And it said, to fathom hell or soar angelic, just take a pinch of psychedelic. So if you break that down, to fathom hell, to understand the depths of hell, and then to understand soaring angelic and being at states of ecstasy, a psychedelic can do that for you. Anyone that's had a very deep, heroic type journey in the, ayahuasca, the heroic doses of psilocybin, LSD, things like that, we will know that, yes, there's moments where you feel like you're living hell on earth, and in moments that are completely ecstatic and pure bliss. And so ketamine falls into what you call an atypical psychedelic. Ketamine is a dissociative anesthetic with psychedelic properties when given at a sub-anesthetic dose. And so we have the classic psychedelics. That's going to be your LSD, your DMT, your psilocybin, your mescaline. Most of these are activating the serotonin 5-HT2A receptor pathway, whereas ketamine is an atypical psychedelic and works mainly via NMDA receptor antagonism. We do call ketamine a dirty drug because it works on a vast array of receptor systems, opioid receptors, serotonergic aspects to it. So it really can help to modulate these different receptor systems and help out with other drug addictions potentially. And we're seeing some of that that promise play out.
So fascinating to me. And one other question before I haven't even let Chris, Chris hasn't even dove in yet.
I ran, dude. I go off on tangents.
Yeah, but so okay, let me pose a scenario, right?
Yeah.
You have like someone like myself who has not lived, I haven't had a traumatic life, right? Like I've been blessed. Both
Hmm.
parents was raised, great. We didn't have a lot, but we had enough. There's no history of like, I was never sexually abused when I was a kid. Like there's no
Hmm.
trauma in my life that I know of, that I'm aware of, right?
Yeah.
Have you had anybody come in similar to like what I just told you, that didn't feel like they had trauma, but they went through the program and then they realized that their body had kind of shut the door on that trauma, and they
Yeah.
didn't even realize that they had this experience, and now because of this ketamine therapy,
Hmm.
you open the door. You were talking about closing the door. You open the door to something that might have been really, really traumatic for them.
Hmm.
Now they're, whoa, hold on, and now you got to deal with that. I'm curious.
Yeah, I mean, pre-verbal trauma, perinatal trauma, right? Things that are in the unconscious mind. We have had some patients that, maybe they're in their younger years, 5 years old or something, and then an older sibling might have molested them, and
Yeah.
then this came up in an infusion, but they had manifested in their body this dis-ease, this disorder, right? They just always had this like pain or a little knot in their stomach and could never really understand what it was from.
What it
And
was
then
about.
we like fibromyalgia type like symptoms, right? Because there's a book, Dr. Bessel, The Body Keeps the Score, right? So looking at, okay, that trauma, it's still in your body at like a cellular level and it's just been repressed,
It's
right?
yeah.
So there's a great quote by Dr. Carl Jung, and it's, until you make the unconscious conscious, it will direct your life and you will call it fate. And so I'm trying to get you to take the unconscious, subconscious mind and reveal it to the conscious, because you might have things that are, in there that you're not aware of that happened. And then also, like, the ketamine allows you to view it from like a distance. It just changes. It's almost like you're watching your life's
Like
movie.
an out of
But
body experience.
you can have the out of body experience, that a dissociative experience, but also just you're viewing it like third person, where it's like you see it and it's almost like you have this emotional bulletproof vest. So you're just not as reactive to it. So ketamine assisted psychotherapy is another discipline that is really like breakthrough, as far as like you can get there and get deep and be like, we call psycholytic, like lysine the psyche. And so you'd be more open in a therapy session, and then you can process it different than if you were in a completely sober mind. Like people do EMDR, the eye movement desensitization
Yep.
reprocessing. If you do that concurrently with ketamine, like do a ketamine infusion, the first three, and then the day after number 4, do an EMDR session, fifth infusion, day after number 5, EMDR session, you're gonna get way more out of it than if you just did either of these disciplines alone. So there's a
Alone.
synergy between ketamine and a lot of other disciplines. Also, you don't have to have, I mean, we all lived through a pandemic. We've all gone through the growing pains of life, breakups, probably lost a loved one at some point in time. So you got the big T traumas, the little T traumas, right? So we all have things that are affecting us in this human condition. The equation is trauma plus healing equals wisdom, right? If you have no adversity in your life, there's nothing to heal. How do you gain wisdom in this incarnation? In short,
Yeah.
no rain, no rainbow, right? Well, I don't want the
Good
rain.
point.
Well, then you don't get the rainbow. Sorry, that's
Then
just
you
kind
don't
of,
get the
I'm
rainbow.
just an
Yeah.
interpreter, and I
Yeah.
don't make the rules. So even personal evolution, ketamine can help with that as well, to see your life through a new lens. My analogy is like, imagine if you never looked through a microscope or a telescope before. Do you have to be a scientist to gain value from looking through a microscope? Of course not. We all had biology class, saw the paramecium, the amoebas, right? Seeing life with a different perspective. So I'm just trying to look at your life through a new lens. You are the medicine. You
Now,
are. So
after the session, do you sit down with that
yeah,
patient and interpret what
I
they've
try to.
kind
Yeah.
of their experience, like,
Yeah, I try to be
you
like this
know?
dream interpreter. Essentially, I'm like your ketamine Sherpa. I've walked the path many times, and so like even today, this guy, like just happened today. Like he's like, during my infusion, everything was ashes around me, ashes around me. I'm like, well, here's my interpretation of that. You told me your marriage is on the brink of divorce. It's falling apart, right? So there is a crumbling around you, right? Your kids are about to move out of the house. You're about to be an empty nester. Like you don't like your job, but you think that's about to implode, right? So that's metaphorically showing you. But I did say to him, your ego is your learned identity of self. Your ego would rather keep you in a familiar hell than allow you to move into an unfamiliar heaven, right? And that's a
Mhm.
big concept, right? It just wants what's familiar. It doesn't want what's best for you. And as soon as you start to realize that hey, the comeback is greater than the setback. Maybe this unfamiliar future might be the heaven that I was questing to get towards. Right. So
Mhm.
that was today, like interpreting that for them. And then also like in the moment, some people do want to divulge and talk and integrate. And we have time, we do that. But also your integration sessions are the day after with your coach. So you have time to process and digest, and now you can
Mm.
make sense of things. We really encourage journaling, at least 10, 15
I was
minutes a
going to
day.
ask that.
Yeah, you got
Yeah.
the workbook. Like this is a program around the medicine. It's not just take the medicine and try to find your own blind spots. It does not work. You know,
Yeah.
you cannot see your own blind spots. That's, you know,
That's
Yeah.
awesome. I
Chris.
like how you guys have created it into a complete program, a comprehensive program at that.
it's
Yeah.
necessary. Well, this is over the culmination of 5 years and, you know, 10,000 plus infusions. We've created this. Day one didn't have the workbook.
Kind of redefined it.
Now, let me
Yeah.
ask you. So, how long you talk about the program? It sounds really, really fascinating.
It is.
How long is the program to where, like, hey, if I'm a new patient, I come to you, I drive. It's in Phoenix, correct? You're out
One in
of
Scottsdale, one in Gilbert. Yeah.
Yeah.
Two
Okay. So you're
clinics.
Scottsdale. I drive to Scottsdale, and I'm like, all right, Dr. Latham, I'm ready. What am I looking at as far as, you know, a core or a length of like therapy? Like, is it 6 weeks, 6 months? Like, what are we looking at?
Oh, yeah. So yeah, generally someone's battling like anxiety, depression, PTSD, and there's usually treatment resistant patients. They've tried everything, and then finally like, hey, ketamine, this might work. And I'm also trying to like shift the paradigm that you don't need to needlessly suffer trying all these other things. Why not look at ketamine as maybe a first resort?
As a
You know,
first one,
early on.
yeah.
I would still say like nutrition, sleep, exercise, sense of purpose, community, spiritual practice, meditation, journaling. Do that kind of stuff first, but that's not working. You know, talk therapy can only get you so far. Think about ketamine. So normally for the mental health, you know, disorders, the anxiety, PTSD, depression, you're doing 2 infusions a week or 3 infusions a week with 6 total. That's what we call induction or stabilization. And so
6
someone,
total. Okay.
yeah, so we do basically an in-person consultation, completely free, no obligation. I got to meet you to then decide like, hey, what if you did ketamine somewhere else and we just need to restabilize you with 3 infusions? Maybe you don't need the 6, right? So it
Yeah.
depends. Or you're on a lot of medications. We might put induction out to 8 or 10 infusions. So it does vary widely, but generally 6 is where most places start. All of our infusions are 60 minutes minimum. I can usually get people in within a week, like very quickly, because we got 3 doctors and 2 clinics. We have a few nurses that work with us as well. And what you're going to do is a 1-hour prep session. Of course, after your medical history has been done, you've been cleared and screened, all these things, not an active addiction or something like that. So do that, and then you do a 1-hour prep session over Zoom with your integration coach the day before your first infusion, ideally. And then the day after that would be infusion 1, and then your integration sessions. You have 3 hours total of integration. The integration sessions are the day after infusions 1, 2, 4, and 6 for our specific protocol. And that's the starting point. And then at number 6, we're going to assess how are you doing. All this is evidence-based. If you don't measure something, you can't manage it. So we're doing PHQ-9 for depression, GAD-7 for anxiety, PCL-5 for PTSD, an ACEs score, the Adverse Childhood Experience score. You have to do these surveys to have a baseline starting point. I need to show you quantitatively how you've changed over the past 2 to 3 weeks. And now I can make an assessment of should we go towards maintenance or optimization? What are the things can we offer? Right? So everything's tailor fit to the individual. You know, it's precision medicine, not just like
Is there ever a time that or is there a scenario that you would decline services to someone, and why would that be?
Oh, for sure. I mean, if you're in the active throes of addiction, I had a guy come in and he was like literally like taking fentanyl like every day.
Yeah.
And then he didn't tell us that initially, but then when he came in, I did talk to him. Like, I'm trying here to help you. You know, do you take any medications at all? Well, you know, I get fentanyl from a friend, but I trust him. And I was like, I'm sorry, dude. Like, you're not ready to go into this type of treatment. How do I know that fentanyl's not laced with something? I got to look out for your best interest of heart here. And so, like, you need to detox from that first, or at least, you know, go with something that's prescribed to you, because it's not even prescribed to you. How do I know you have meth in your system or something else? So,
I know
so
this
like
guy in the cartel, he gets me this fentanyl. Like,
he's cool.
I was like, hey, this is not a good fit.
I trust
so like,
him. He
I
speaks
don't want to waste
English,
people's
you know,
time.
so,
I don't. No, totally. You got to know where it's coming from. Yeah, and then how motivated are you to get better? So like, you know, a lot of times the parent, especially if someone's a teenager, early 20s, and the parent's paying for it, I make them come in for sure and have that discussion of, hey, you're an active participant in this process. It's not just, hey, doc, give me these medicines, make me feel different. That's passive medicine. And so getting them to sit down and realize like, hey, what you put into this, you're going to get out. And if you're not willing to make that commitment to yourself and be an active participant, we're not the right clinic for you. Right? I want to like, you got to be ready.
Let me ask you this. So the program sounds amazing. How receptive is big insurance to it. Like, do you guys take insurance? Does insurance cover treatments like this? I'm curious.
Yeah, totally. Ketamine's deemed or IV ketamine's been deemed experimental by the insurance companies, so they do
Okay.
not overtly cover it. What we do offer people is super bills, and so I can put your diagnosis codes down, your treatments, the cost, and you can submit that to your insurance retroactively, and sometimes get partial reimbursement. It varies widely. It has to be a commercial payer, Blue Cross, United, these types of guys. I would always tell people, call your company for your insurance carrier first. Just ask them, hey, I'm thinking of exploring infusion therapy with ketamine. Would I be able to get some retroactive reimbursement if I submit a super bill? And we'll provide those to you. Now, the only type of ketamine that is covered by insurance currently is Spravato, which is nasal ketamine. It's S-ketamine. It's half of the molecule, but this is Big Pharma's Band-Aid approach. Max dose 84 milligrams. You do the 3 sprays in the clinic. You're there 2 hours. Take your vital signs. There's no integration around it, and it's now been approved as monotherapy. It used to only be approved if you also were on SSRIs. And this is just another one of those just Band-Aid. And I don't want you to Band-Aid. I want you to heal, and it's lifelong healing. But ketamine like gives you that quick win, makes you feel better faster. Then you start changing your daily practice. Here's an equation on our workbook. It's ketamine plus daily integration practice equals a conscious transformation. It's not just the medicine equals a transformation. The daily practice is the key. Ketamine is the key to me, but it's just one of the keys.
Yeah, well, you got to put in some work.
It makes total sense that like Big Pharma, big insurance, they really don't want you to heal. And then we could go down that rabbit hole.
Yeah, totally. Yeah.
You know what I'm saying? Like they would rather keep you on the,
perpetual illness model,
Exactly. The perpetual illness model. Correct. So it makes total sense. So that maybe that's why they give you the nasal at half the molecule. They just keep it going. Just,
well, they patented it, right? And then you have monopoly because, the ketamine is a generic drug. It's been around 1964. August 3rd was the first ever human administration. FDA approved 1970. I mean, it's been around for over 50 years. It's been given billions of times on planet Earth. We know this better than most medicines in all of medicine. It's exceedingly safe when, of course, given, with supervision with physicians. Yeah. And that's why I do prefer IV as the route of administration because it's so controllable. I call IV on an infusion pump like we do it the most controllable psychedelic medicine experience on planet Earth because I can literally just stop it and pull you out of it in less than 10 minutes, at least the peak experience. You'll still feel some after effects, but peak experience take you out in less than 10 minutes. So very controllable.
There's a way that you can pull someone out of it? And what is that? Are you administering another medication to revert it, or
just stop the IV?
Just stop it. Yeah, you're getting a continual infusion at a precise rate from the infusion pump. Like these syringe pumps are over $4,000. Like I'm not like just dripping it from a bag, like
just holding it up, just shaking it to get the rest of it out.
Yeah.
So you stop it, but how long from stopping it to the person's not feeling the effects anymore? I mean, it's not going to be automatic. They're still going to be feeling it, right? So how long does that take?
Yeah, totally. So ketamine's half-life is about 2.5 to 3 hours. So sure, like you're going to feel like a little woozy. You'll feel some of the effect, but I'm talking take you out of the peak experience less than 10 minutes. And the thing is too, like on the first infusion, I'm just dipping your toe in the psychedelic pool. Like, and then at 30 minutes, I do a check on you and hey, do you want to go ankle deep or you want to go knee deep? We're not even going to let you to dive in. Right. So that first day, I can take you really out of it very quickly. So the fact that you're always in control, that's how you can get a human being to truly relax because they do know they're in control. They got like the parachute.
So are they somewhat conscious in this?
Always conscious the entire time. Everything.
Yeah. I mean, obviously, but like coherent, I guess, is the word. Because when I hear psychedelics, right, it's like, okay, the house is on fire and I'm staring at a blank field. You know what I'm saying? Like I'm thinking of like there goes a dragon.
Cognitive function out the window.
Yeah, like you know what I'm saying? Like so I'm wondering if under the IV, under the drip, are they coherent to where if you ask them a question, even though they might see this dragon or these ashes, you can have a conversation with them and they can answer you, obviously, correctly
coherently
or
depends on the dose. It all depends on the dose. So like the first 3 infusions, I'm just laying the foundation. 4, 5, and 6, I'm building the house. Right. So I'm going to get you very familiar and confident in this medicine. I'm going to walk you in very gently. I call it like walking from the beach into the ocean. And we're not just taking the boat offshore and diving in. right?
Yeah.
So you're going to learn how to navigate it. It becomes very familiar, even though every infusion is going to be different. Even though it's the same person, I could play the same music, same dose. It's still going to be different every single time. It's just like same book, different chapters, essentially.
Safe space. You're giving them a safe
Yeah,
space.
it's a very introspective experience versus most psychedelics are done by people. It's an outside your body experience. You're at a festival, you're interacting with people, it's more recreational. I'm trying to get you to go within so you can get beyond how you're feeling. My quote with ketamine is ketamine can help you get into your mind so you can get out of your head. And a lot of people are stuck in their head, essentially.
Well, I feel like this has to be like a session because time has flown by. Like literally we have
already.
Yeah, it's gone by so fast. Like
we're just getting cracking, man.
Yeah, and we just like your first 3 sessions, we're just cracking the surface, right?
We just laid the foundation. We'll build the house
We just laid the
later.
foundation, right?
Yeah.
And so I find this topic so fascinating. Like I almost want to try it just to see, like that self-evaluation like you talked about, right?
You can. I mean, I gotta medically screen you, but sure.
What exactly is wrong with me or what my body's keeping score of.
Yeah, which we'll hold on to.
Yeah.
It's a show you, not a tell you. It's ineffable. Now, if you want to expand on the house analogy, your mental health is like a house that's on fire if you're dealing with depression, anxiety, PTSD. Ketamine will likely put that house fire out very rapidly. However, it will not rebuild the house for you. Only you can do that.
Only you can do it.
Oh,
it's a tool. It's a tool.
That was well worded. I like that.
No, well, how does it work with like when you're dealing with people that substance abuse or like alcoholics that are trying that are trying to combat that addiction? Like just take alcoholism as one of them.
They're self-medicating. It's escapism, right? So what's the root cause that led to the alcoholism? Addiction is a temporary solution to try to heal the problem that's going on within yourself. So you're trying to escape. I'm trying to get you to connect, to reconnect, essentially. So you got to get to that root versus just masking the symptoms. But alcohol is readily available, right? So it's obviously abused in our society and it's celebrated and revered, but it's an escape thing. And also you got to look at, are these things ego inflators? Or are these ego deflators or ego dissolution agents? So most of the psychedelics are ego dissolution agents, like ketamine, whereas like cocaine, alcohol, these enhance the ego, right? And your ego is just your learned identity of self. So really, you got to get to the core, get to the root. That's why are you using that substance in the first place? What was the generating, event? Was it a trauma, abusive childhood? The ACEs score is a very revealing test that we give every patient. It's only 10 questions. And a lot of people you can kind of see,
that's fascinating that you can narrow it down just with 10 questions, right? Like
for the lot,
we ask more than 10 questions on this podcast every episode, and we can't nail down shit. So
you should do your ACEs, do your ACEs survey. I'll send it to you if you want. Give me your email. I'll give you guys the free surveys. You can try it out. I'll just run you through it.
I would honestly, Doc, I would love to do that. So when we have you back for the second episode, or your second episode,
we'll review your scores.
Yeah, we can review the scores. I have no problem putting it out there, but I think that's so fascinating that let's do it. I'll give you my email off air and then you've got Chris's, and so
we're all on the email chain.
I'm all for it. I would love to do it. I would love to.
You don't measure it, you can't manage it. You got to test, don't guess. Same thing with labs and blood work, right? So if someone's not responding to ketamine, I'm going to do your blood work. I mean, we do blood work in our clinic. I send it out. Like you could be hypothyroid, you could have B12 or vitamin D deficiency, right? Your testosterone could be low. So there's other things, like we're a wellness clinic, but ketamine is our main niche. And it's my passion, man. I'm really, it's an honor and privilege to give people a non-ordinary state of consciousness in a controlled environment and help them to heal. That's what you're trying to do as a physician. You're trying to elevate your fellow, humankind to be the best version of themselves. And that's what I'm trying to do for everyone out here.
I want to drive 8 hours, 6 hours to Scottsdale.
Welcome anytime, man. You're welcome anytime.
So, plug Advanced Wellness. I know that we're coming to the end of the episode, but plug what's your website? How can people get in touch with you? And then, Chris, let's get Doc on for a second episode in the next couple of weeks.
Part 2 is going to be interesting. I'm excited for part 2. It's going to be different.
Looking forward to it, man. Yeah. So, Advanced Wellness and Pain.com. You got to put a D on the end of advanced, so advanced, and then and is spelled out. On Instagram, psychedelic _DRS. You gotta know how to spell psychedelic. PSYCHEDELIC.
I need to take a psychedelic to learn how to spell psychedelic. So
Yeah, it can be tricky. And then if you just want to even do a free in-person consultation or call in 480-631-4800, 8 to 5 Monday through Friday. You even text that line, we'll get it. We are here for you. We really are. And
love
like
it.
I'm trying to raise awareness, educate, inform, entertain a little bit, have fun, like
yeah,
life is beautiful. We're all just human beings on this blue rock hurtling through space, going around the sun at over 60,000 miles
life
an
is
hour.
beautiful, isn't it?
Wild.
Life is beautiful. Life is beautiful. Hey, well,
and you are the medicine. You are.
Well,
You gotta believe
Dr.
it. Are you
James,
the cure or are you the cause? You gotta
Yep.
ask yourself that.
Hey, Dr. James Leathem from Advanced
Thank you.
Wellness. Thank you so much for joining the show this week. You're going to be back. We're excited. We're going to do those surveys, and then we're going to talk about it on the next episode.
We're just going to do part 2 next week. I think this just needs to be no break in between.
Yeah, let's do it, man. Let's run it back.
Let's
Matt,
do it.
Chris, I appreciate your time. It's been really fun, and hopefully we just enhance someone's ride to work or ride home.
Too.
And enjoy your time with your family. Happiness only happens in the present moment. So whether you're with yourself or family or friends, just bring your awareness to your breath. Tap in. There's my little one-line around breath work. The mind follows the breath. The body follows the mind. The mind follows the breath. The body follows the mind.
Yep.
So who's in charge? You are of the breath. Use your breath. It's your greatest tool. You don't believe me? Life is a psychedelic experience perpetuated by huffing oxygen. Stop huffing oxygen, the psychedelic experience of life ends.
Yep.
That's very true.
You're so right. You're so
if
right.
You're alive, you're breathing adequately, but are you breathing optimally? That's the question.
I love it. Well, life is beautiful. And until next week, guys, we'll see you soon, Mind Splitters.